Test. Everybody, mic test. Good. 1, 2. 1, 2, 3, 4. Everybody good? Mic test. Okay. So just really quickly, we have Tiana and Luisa who will talk about our vaccine clinics and the loss of federal funding. If you guys are interested afterwards, we have our Public Health Heroes event taking place afterwards, and then the commissioner is available to speak, but not till 1 o'clock afterwards. So if you want to stick around, let me know, please, afterwards, and we'll get him to speak. And then the other thing, just you guys probably understand this, we cannot answer any questions about the TRO, or we can't answer any questions, obviously, about the lawsuit. If you guys want questions about that, please go to the Attorney General's office in the state. I appreciate that. So they're going to make a quick statement about themselves, who they are. They'll say and spell their names for you, and then have a way at the questions. Sound good? All right. Do you want to go first, and then Tiana? Come up and stand together. Yep.
Hi everyone, my name is Luisa Brandão. I'm a Director of Public Health Initiatives with the City of Minneapolis Health Department, and in that capacity I supervise maternal, child, and adolescent health, epidemiology, research and evaluation, and emergency preparedness. And the funds that were cut directly funded work that both our epidemiology group and our maternal, child, and adolescent group were doing. So the community vaccination clinics, some work that we're doing with Minneapolis Public Schools to update immunization records of students, and other work in education around the importance and benefit of immunizations.
Say and spell your name too.
Oh, my name, so Luisa, Luisa, and last name Brandao.
And did you say your title to camera?
I did.
Okay, great. All right, Tiana.
Yeah. Hi, good morning. My name is Sebastiana Cervantes. It's spelled Sebastiana, and then Cervantes is Cervantes. And I'm a senior public health specialist and the immunization coordinator for the city of Minneapolis and the pop-up clinics. I've been doing this work for the last 3 years, and it's devastating to see how quickly those resources were taken from our community. This did also affect my position, but I've been supported by our health department through other means to stay on and still uplift the work that is still going on. Yeah, it's just been a whirlwind, but we're still here continuing to promote the health services that we can with our communities.
Questions?
Can you walk us through a day, maybe, what it's like within one of your clinics?
Yeah, for sure. Yeah. So our clinics are unique because we try and work outside of the normal scope of clinics that usually do, Monday through Friday, 8 to 4:30. Our clinics target weekends, target evenings, times that we can really assess those barriers for communities who might not have the opportunity to go to those regular clinics. So it starts out with reaching out to local organizations. We've had many amazing partners and local organizations who host us, where we can actually meet the community where they're at. And then in those spaces, we're allowed to bring those resources to those communities.
There was an outbreak of measles and whooping cough earlier last year. What role did your guys' vaccine clinics play in stemming that tide?
Mm-hmm. Okay. So at that time, we were working with other partners like Hennepin County to host clinics and to really try to make measles vaccine, MMR vaccine, accessible to communities easily, so that where there were no appointments, people could just walk in and get that vaccination. So, I don't know what numbers in terms of people that would have been susceptible, how many vaccines were given, but definitely these free community clinics played a role in providing MMR vaccine to people that would have been at risk.
These were, as COVID-19 funds, they would have sunsetted at some point anyway, correct?
Correct.
What was the timeline supposed to be?
So there were part of the funds would have sunsetted June 30th, 2025, so in a few months. And then the other remaining funds would have sunsetted March 31st, 2026. The fact that all this, we received an email on March 25th saying stop work as of March 24th, changes our didn't allow us to really go through and look at sustainability and the planning that we were doing, because all of a sudden the funds were gone.
But there would have been planning to try to figure out how to.
Correct.
Because that funding wasn't permanent anyway. But
No.
there was planning to try to continue these efforts. What was that?
Correct. So we were working with the city, with the health, within the health department to look, and with partners to look at how can we sustain some of the efforts. Perhaps we wouldn't be able to continue to do the community clinics, but could we have continued to do some of the education and connect with partners where they could host and we could support in other ways, and then looking at how were we going to maintain the staff. So, but all of a sudden it becomes a lot more difficult when it's a sudden takeaway of the funds.
So expound and tell us more about the impact of being able to plan versus just an abrupt end.
Yeah, so if you're able to plan, you have time to adjust and to work with partners to get things in place. By having that abrupt, I had to send emails to our contractors to say stop. We had to cancel our community clinics that had already been publicized. It was a shock, and so we're reeling a little bit, and we are trying to now go back and figure out how to do that. Still to do some planning and how can we maintain. So we've been able to keep Tiana's position, and there was the position that was working with Minneapolis Public Schools. We're still able to support for a little bit, but we're trying to figure out how we're going to be able to continue that work.
Can you talk about the direct impact to child vaccinations and how big of a deal that these aren't going to be happening anymore because of this other stuff?
So, as you guys probably have heard, Minneapolis immunization rates fell because of the COVID pandemic, and so these community clinics are providing an opportunity for parents to bring their children, get caught up without having to, if they don't have insurance, if they didn't have a primary medical home, to at least have the child come and get up to date. It impacts ability to attend school, all of those things. So, all of a sudden that is a resource that is no longer available to our community. The direct impact, the numbers, Tiana has the numbers of childhood vaccinations we did last year. So that's childhood vaccinations that may not happen, and that is going to impact our vaccination rates, and we already are not at where we would want to be with most childhood vaccinations.
So if it's 30% below where you want to be, what could the impact here be going forward then?
Well, we're susceptible to, you mentioned the measles outbreak last year. We were able to contain it. I think it was at 42 cases. You're seeing what it can happen when you have a large unvaccinated population. Is happening right now in West Texas. We're over 500 cases there, and if not saying that that's going to happen here, but we are at risk of another outbreak if a case is introduced.
Is there enough people vaccinated against measles to prevent what happened in West Texas, or to prevent what happened last year?
Well, we have better vaccination rates than West Texas, but we are not, herd immunity for measles is 95%. We're well below that. So.
More to Rob's first point about just you knew the money and the funding would come to an end, but the communication, as we're hearing from other agencies, that's not usually how it works with the federal government. So that is also what has been very hard to navigate, correct?
Correct. We knew the money was coming to an end. We have grants, we work with grants all the time. There is a period of performance, and you work based on that, and you make plans for that. To get an email the day after you're supposed to stop work is not the way things normally work, especially when we have been doing the work and there were no, that we had not been told that the work was not satisfactory.
And I think the devastating thing too, also on top of that, fostering trust in community is continually having communication, being present, and to get that kind of waterfall effect. Some of our contractors that we worked with were hit multiple times by this. local organizations who don't even work for government are now, more and more resources are being potentially taken because of the withdrawal of these funds. So it's just, it will be interesting to see how the dust settles. I know, like, after the last few weeks, I plan to meet with some of our local groups that we've been working with just to still prop up the work that they can do at this time. Yeah.
Who are those local organizations that you guys work with, that you guys are close to?
I'm sorry, can you repeat that?
Who are the local organizations that you guys work with that provide these community clinics?
So there's a variety. I mean, Diana, in terms of the providers that were actually the vaccinators, people that were doing the vaccines, M Health Fairview, Odom Medical Clinic, and Neighborhood Health Source were the clinical partners, but we had many more community organizations that were hosting us, and Diana can speak to
so
that.
like we've done continuous clinics at the Family Partnership, Jordan Area Community Council, and a slew of other ones. You know, again, these are pop-ups, so sometimes we're able to do multiple in the same location, but we do like to spread it out. So we've worked with tons of groups. Yeah, schools. Yeah.
What was your experience like in the last few years of doing these clinics? What were the stories you're hearing from people that illustrated to you the impact you were making?
Yeah. A lot of the people we interacted with were really happy to see us out in community and providing this service. They were like, oh my gosh, I cannot believe you're here. Now I can get my vaccination. We've had families who bring their children last minute who didn't think they would be able to go to school if they didn't get the vaccination and just happened to show up in one of our South Minneapolis pop-ups. One of my coworkers had talked to a father at one of our Corcoran Park vaccinations who said, I wouldn't have been able to get these vaccinations had this not been here. So I mean, these are just a few stories, but in most cases I think community's happy to see us out where they're at, really coming to them as opposed to bringing them to systems that might not fully be able to serve them in the needs that they have.
What was the gap here? Why were these people, they were very appreciative that they could get this through you. Why were they unable to get these vaccinations otherwise?
You wanna? Yeah.
I mean, I think there's a variety of reasons. I think some people do not have insurance. Even though Minnesota has lots of programs, people are uninsured, and so they're not necessarily going to be able to go to a clinic, because even though children can get vaccines for free, you still often have to pay a visit charge or something like that. Also, some people don't trust the medical system and they are not going to go to a clinic, but they might come to a community organization that they trust, and if we're there, then we become trusted partners by extension. I think language barriers, we prided ourselves in having interpreters and translation and having the information in multiple languages, so making it more accessible. And then the fact that they could just walk in and didn't have to go through making an appointment and filling out a bunch of forms, or we could help them fill out the forms. And so, I think there's a variety of reasons.
You seem pretty emotional about this.
Yeah.
So, what was the emotions of what you were able to do the last couple of years, and the emotions of what you're going through now? And this made an impact on you, obviously.
100%. I'm extremely thankful that I still have this job. And it's also devastating to the communities that I've continued to work with. I've been at the health department for 10 years, 3 years doing this kind of work. And to know, also I'm a mother, so to know that there are children out there that could potentially not have resources to be protected from certain things is very emotional and very devastating. Yeah.
What impact do you think you made during the last 7 years?
I guess, the resources are there. I would hope that, we have created a space that was safe for the people that we were working with, really trying to look at the barriers that we have seen and address those. And
But what I'm saying, you personally felt that accomplishment you did.
Yeah, 100%. Yeah, I felt like we, throughout this whole process of doing this work, were very specific to serve our communities, very intentional from hiring the liaisons that we have here at the health department to the contractors that we put on to do this work, to be very cognizant of the needs of our community. And it's devastating to think that this has come to an end.
In defense of these cuts, the administration has essentially said COVID is over. We need to move on and put this money elsewhere.
So,
Do you believe that? But also, there's other things besides.
so COVID is over in terms of a pandemic, but people are still dying of COVID on a regular basis. So I hate to say COVID is over. These funds were for recovery from COVID, and we had many things that happened because of COVID. For example, childhood immunization rates dropped during COVID because access to medical care was curtailed because of what was happening. So these, if you look at the work that was being done at the state, at local levels, across the country, much of the work this funding was supporting was recovery from COVID. So these community vaccination clinics were recovery from COVID. So I don't, I take issue with saying COVID is over and therefore this money is not needed anymore because, one, COVID isn't over, and two, there were a lot of fallouts from COVID that we still need to be addressing and we're addressing using these funds.
Right, how many lessons we learned from the pandemic?
Exactly.
Exactly.
And to speak to, I think the other work that this was doing was to build trust back into that we are here, the city of Minneapolis is here for the residents and is providing services to residents, and that we are a partner, not, Big Brother or the government trying to tell you what to do. And so I hate to see us, it's not our fault that the funding went away, but it is another time where we have to say to community, oh, sorry, we had planned to do this, but now we can't, or we're, it comes across as maybe it is damaging to that relationship.
I'm sure there's some uncertainty in your office right now too, just unsure of how things are going to shake out with funding for these programs. How are you kind of bracing yourselves for any of those changes with uncertainty?
Yes, so we have a lot of programs that are funded with federal grants, either directly or as this was a pass-through from the state of Minnesota. We are doing an analysis of what that would impact and what our priorities are and how we are going to need to look at our entire funding structure and and what we'll be able to continue doing. So, not planning for the worst, not hope, sort of planning for things, hoping for the best, planning for the worst is, I think, what people say, but that's what we're looking at. And it is an uncertain time, and it's an uncertain time to be in public health right now.
And are there even options for other funding? Like, where can you look to try to bolster some of these programs?
I think we'll be looking at other possibilities, and we'll continue to work with the city and to just see. But it's hard to think of where else we'll be looking for funding.
Can you comment on how much the funding was in total?
So the initial amount of funding we received was a little over $3 million, and we were, I think, I don't want to quote exactly, but it was a little less. We had about 1.5 million left, so about half of the funds were left that we lost. And so these are funds that were passed through from the state. So the state is the grantee, and then they pass them down to local public health. So the city of Minneapolis is one agency, health department is one agency, but there's other agencies in the state that basically were also affected in the same way.
Is there a way to put a number on how many kids might not get vaccinated?
Yeah,
You know how many were vaccinated last year.
Yeah, so we can share that data, and I'll give it to Scott. Just the amount of children that could
miss out on
Who
vaccination.
may miss out? I'll talk to them, see if we can get that data and let you guys know.
Yeah.
I believe it's in the
There were numbers that have been vaccinated.
Yeah,
Yeah, so I mean, so those are the numbers that that probably could miss because, again, those were the numbers that we vaccinated last year, and we would be doing, I would assume, the same or more this year.
What role do these programs play, these pop-up clinics play, when you guys are doing immunization with people who are immigrants who might not have proper documentation, or people from Black or BIPOC communities?
So we don't ask about documentation. That is not, we are there to provide a service. So we know that people that maybe will not access some other places because of fears of not having the proper documentation, we're accessing our services, and but we're not going to ask because that's part of being providing that service. And we were very specifically going into areas and having the clinics in areas where we know the immunization rates are lower, where there are issues with access. And so I'd like to think that we were clearing some of those barriers, and was specifically for our BIPOC communities who have lower rates.
Anything else, guys? Good. Who is, just out of curiosity, anyone staying for the awards ceremony and want to talk to the commissioner at 1?